Good afternoon. Today I would like to talk to you about a health crisis that I feel is largely being ignored by our medical health providers and insurance companies. This health issue has caught the attention of several practicing doctors and physicians across the nation. However, this issue is largely being ignored because medical research and scientific discovery regarding this potential crisis is still surfacing. If not addressed more aggressively, then this health issue could lead to a worldwide epidemic over the next several decades. Additionally, insurance companies are reluctant to pay for continued and long-term treatment, partially due to government intrusion. What I would like to share and discuss with you today is the issue of tick-borne infections. Some of you may have no idea what I'm referring to, and some may have some basic knowledge but have no real understanding about tick bites and tick infestations. For starters, we will discuss the most common tick-borne infection that most have heard of, and that is Lyme disease. In the early 1970s in the town of Lyme, Connecticut, several people were suffering from some puzzling and debilitating health issues that were erratic, inconsistent, and varying in nature. Neck pain, skin rashes, joint pain, chronic fatigue, cognitive issues, brain fog, depression, heart arrhythmias, tremors, irritability, trouble sleeping, headaches, and muscle aches. What was stifling and so confusing to doctors was that a diagnosis of any real known medical condition went undiscovered. Two mothers persisted in their own research of this strange phenomenon and eventually discovered a connection between all the cases. All the children and people suffering from these conditions had all recalled being bit by something that caused a rash. Finally, by the mid-1970s, the persistence of those two mothers forced researchers and scientists to call this new condition Lyme disease. Research continued into the 1980s, and the bacterial strand that caused Lyme disease was isolated by a scientist named Will Borne. Borne had discovered that this bacterial strand was being carried by the deer tick, and this particular bacterium, called a spirochete, was able to be transmitted through the bite of a deer tick, with transmission possible to both humans and animals. In 1982, the spirochete received its clinical name Borrelia burgdorferi and was recognized as a bacteria that causes Lyme disease. At that time, and still today, the treatment protocol for Lyme is heavy doses of antibiotics if the disease is discovered in its acute stages, which is in usually the first 4 to 6 weeks of infection. However, many are suffering from what is called chronic Lyme, as their diagnosis was not discovered until months or even years later. What is currently debated is the antibiotic treatment protocol length. Many doctors believe that heavy doses of antibiotics past 30 days has no medical benefit. Their belief is that the symptoms they may be experiencing are the result of residual damage the bacteria has done to the body over time. On the contrary, some doctors disagree and say that long-term doses, up to 2 to 3 years, can be effective in eradicating the bacteria completely from the body. This bacterial strand is troublesome and problematic as it has discovered unique ways of hiding deep within cellular structure, organs, and tissues, and despite the length of antibiotic treatment, the medical community agrees that this particular bacteria is extremely tenacious and stubborn. Since the 1980s, reports of this disease have grown exponentially, and in 2012, the CDC reported it as the top 10 notifiable diseases to plague our communities. Today, the CDC is reporting that Lyme disease is one of the fastest vector-borne bacterial infections here in the U.S., with 329,000 new cases being diagnosed each year. While primarily an East Coast epidemic, it is making its way to other areas of the United States. So if we know about Lyme and have identified it as a growing illness in the U.S., then the treatment protocol and diagnosis should be pretty consistent, you would think. Identify the rash, go to the doctor, get a blood test comes back positive, and then go on antibiotics for a month. All healed up and good to go, correct? It's not that easy. Problem number 1. Many do not realize that they have gotten bitten by a tick because there's no guarantee that a rash was even present, and an onset of symptoms, whether present or not, may not have prompted one to go to the doctor. Oftentimes following a rash are flu-like symptoms, but if one does not know they are bit, they may just think they have the flu and need a few days rest. Several people that have never been diagnosed remember getting bit by a tick, and most, including doctors, would never even think to look for Lyme when a patient presents symptoms. As mentioned, symptoms are erratic, inconsistent, and varying. Therefore, if one begins experiencing symptoms weeks or even months after the bite, the patient may be led to a myriad of doctors to try and determine the cause of the symptoms. One experiencing neck pain may go to an orthopedist, while one experiencing joint pain may go to a rheumatologist. One experiencing cognitive issues such as memory loss or brain fog may see a neurologist or possibly a psychiatrist for depression. All along, several of these symptoms are present at one time or another and tend to come and go to where several doctors become exhausted with the patient and just send them home as an identified hypochondriac. Antidepressants, anti-anxiety, anti-seizure, and arthritic medications are prescribed, but the patient never seems to get better, bouncing from one doctor to the next, exhausted and frustrated. Problem number 2. A patient has an identified rash and is experiencing some of the classic Lyme symptoms. They are in front of the issue and just need a family doctor to run a few simple blood tests and confirm the bacteria is present in their blood so the antibiotics can be administered. Sounds simple enough. Wrong again. Today there is heavy debate over what is accepted as a positive Lyme test. Many false positives and many false negatives are seen. The lucky ones notice the tick bite early, get a positive test, and get treatment quickly. This is the best case scenario, but unfortunately this is a small, very small minority of cases. The CDC's current stance for a positive Western blot Lyme test requires 5 or 7 reactive antibodies present in the blood depending on which group they fall into and which test is administered, the IgM, IgG, or a combination of both. Without going into all the specifics about what those tests mean, just understand that the CDC has taken a firm stance on what is considered a positive test, despite research suggesting a clinical diagnosis should strongly be considered even if just one reactive antibody is present. Blood sample timing is also key, and we will see later on that many doctors have no real clear understanding of this. Problem number 3. This is probably the most significant and problematic issue with a Lyme diagnosis and what really encapsulates the scope of my message today. As previously discussed in 1982, Wilborg Dürfer isolated the spirochete bacterium that causes Lyme disease, which resulted in its classic name, Borrelia burgdorferi, which is carried by the deer tick, or more commonly called the black-legged tick. But recall during the beginning of our discussion that I did not start out talking about Lyme disease itself, but rather tick-borne infections. Recent medical discoveries have now identified at least 7 additional dangerous bacterial strands that will not show up on a standard CDC Lyme test in all cases. Now that I have your attention, let's identify some other recent tick-borne bacteria that have been discovered. These have been deemed to be relatively rare, but when tested match for the Lyme reactive antibodies indicate a positive test in some instances. HA, or human anaplasmosis, babesiosis, Rocky Mountain spotted fever, echoliosis, Powassan virus, tularemia, and the final one that I want to spend most of my time talking about that is native to the Midwest, and that is STARI, which stands for Southern Tick Associated Rash Illness. This is associated with the bite from a Lone Star tick, which is very common in the Midwest and particularly in Missouri. STARI often but not always presents with either a bullseye rash or a large red rash that could resemble any sort of dermatitis. Here's what is significant about STARI. The bacteria that causes it is still being debated. At first it was believed to be caused by Borrelia lone stari bacteria, but research is still contentious. It wasn't until the diligent and aggressive work of Dr. Edwin Masters in the 1980s, a small-town family practitioner in southeastern Missouri, who began treating a farmer who had been bitten by a tick. This farmer was otherwise healthy in his early 50s, running a multi-acre farm. The complaints made by the farmer were still all the similar symptoms that had been discussed here: joint pain, neck stiffness, chronic fatigue, depression, cognitive and memory issues, and headaches, amongst many others. Inconsistent manifestation of symptoms would come and go and continue to plague the farmer to the point where he had to stop working. Neurological testing, blood tests, and all other available modern medical testing led to dead ends with no diagnosis. What was interesting about Dr. Masters is that he recognized that these symptoms were so clinically consistent with Lyme, therefore why not treat it as such? So that is exactly what Dr. Masters did. 1 year after several doses of different types of antibiotics, the farmer reported feeling 100% and back to normal. Word spread and other patients followed, touting similar stories, resulting in successful treatment and remission of symptoms. This was an amazing discovery, as Dr. Masters now had the proof in the pudding to show the CDC that he had discovered that the Lone Star tick was carrying a bacteria that was causing Lyme-like symptoms in Missouri. Dr. Masters' treatment of this farmer in the mid-1980s sparked controversy between the medical community and the CDC. The CDC would continue to stand their ground, refusing to consent that the Borrelia lone stari was not causing this Lyme-like condition, despite the proof shown by Dr. Masters. Despite the disagreements, onward Dr. Masters and other colleagues of his went, as he would fervently show evidence to prove that Borrelia lone stari did in fact cause the stari tick-borne infection. Unfortunately, to this day, the CDC only gives STARI its name as a result of Dr. Masters' work. The CDC still wants more proof. Dr. Masters died in 2009, but his legacy lives on as several Lyme-literate doctors today are following his treatment protocol when patients report Lyme-like symptoms. So what is the purpose for all this? What should you do if you are currently experiencing Lyme-like symptoms and have been passed off by many different doctors, particularly in the Midwest? Oftentimes, tick-borne infections are an elimination diagnosis, meaning everything else must be ruled out first before a tick-borne diagnosis can be identified. That is currently how the medical professionals are viewing this, which are few and far between. And insurance companies paying for the treatment, good luck. Lyme-literate doctors need more than the regular 15-minute office visit with their patients, and true patient-centered care and compassion, well, your average doctor just doesn't have time for that. Insurance companies often reject a claim for a 4-hour office visit. As sad as it is, oftentimes before a patient makes it to a Lyme-literate doctor, they have been to 6, 7, or even 10 or more types of doctors before they finally find their way to someone who hears and understands what they are going through. This is unacceptable in my opinion. Throughout my research and personal story, it has been my experience that our current Western medical doctors know very little about tick-borne infections and how to diagnose and treat them. I truly believe we are on the cusp of a medical epidemic breakthrough as more cases like the farmer in southeastern Missouri experienced are starting to rise to the surface. So why is this so important, and why am I so passionate about this? Because I was a sufferer. In the spring of 2010, I was bitten by a tick in southern Missouri during a week-long hunting trip. When I got home, I had noticed a large red rash on the inside of my right thigh. At first, I did not think much of it, but it seemed to be getting larger and was not going away. I had also noticed general malaise during this time, but brushed it off as just working too hard. After a few weeks and no change, I was encouraged to go to the doctor after doing some internet research. I agreed and made an appointment with my doctor and told him what I had been through, noting a concern for possible Lyme. Reluctantly, he ordered the lab work as requested, but told me that Lyme doesn't exist in Missouri. A few days later, the results came back negative, recalling the CDC criteria as mentioned previously, for Lyme, and within a few weeks, the rash had disappeared along with my general malaise. On with life I went. A few months later that same year, I had begun to experience some strange symptoms: brain fog, excessive fatigue, neck and joint pain, depression, and just a general overall feeling of poor health. At this time, the best I could describe it was just weird. I went back to my doctor and explained my symptoms. He said, "You probably have low T," and ordered lab testing. He also suggested I may be depressed. I began medication for low T, but over the next several years, I waxed and waned through a remission of symptoms and periods of complete despair. Anxiety, depression, brain fog, chronic fatigue, neck stiffness, sleeplessness, paresthesias, and late in the game tremors in both hands. But they would all come and go, and consistency was lacking. After hours on the internet, I had myself diagnosed with multiple sclerosis, Lou Gehrig's disease, rheumatoid arthritis, chronic depression, hypogonadism, and Parkinson's disease. A family practitioner, 2 psychiatrists, an endocrinologist, a urologist, 3 neurosurgeons, and 2 neurologists, with 3 brain MRIs to boot. Nothing. You are fine, they said. One surgeon had even suggested that a minor genetic malformation in my brain that I was born with may be the issue, but the other 2 disagreed. They were sick of seeing me, and one neurologist put me on anti-seizure medication just to get rid of me. All in my head, they said. Doctors with combined experiences over 400 years of practicing medicine, and nothing ever mentioned about Lyme disease or a tick-borne infection. Nothing at all. I was 43 years old and convinced I was dying and didn't know why. In September of 2016, I was approached by a friend who had asked if I had ever been tested for Lyme disease. I said that I had, years ago, but that it was negative. This individual encouraged me not to stop, as Lyme is very difficult to diagnose. She gave me the name of 2 doctors and encouraged I make an appointment. The first doctor was in Kansas City, Missouri, but was no longer taking patients and hadn't for 4 years. I was discouraged. Unrelenting, I forged ahead and decided to call the next doctor, who practiced out of Columbia, Missouri. The receptionist could hear the discouragement in my voice. Through nothing less than a miracle, she was able to get me in through a cancellation. Basic information over the phone, and a packet was emailed to fill out. I was optimistic but frightened at the same time. The day of my arrival, my examination took 4 hours. My clinical symptoms had a match: a tick-borne infection, most likely the Starry. What does all this mean? My doctor had mentioned that oftentimes he is a last stop for many patients. They see a plethora of doctors with no answers, no diagnosis, and no solutions to their suffering. Many are in fact misdiagnosed and then treated for MS, ALS, or Parkinson's disease, but have none of those diseases. He then looked me straight in the face and was very stern in his remarks. He says ALS, MS, hormone and thyroid deficiencies, and Parkinson's are tick-borne infections until proven otherwise. The research is there, but we are in a desperate fight right now to get the government, specifically the CDC, to accept this new epidemic. It will take an act of God, he says, before medical science and researchers will get their act together. And it's sad because people are suffering. Government acceptance of a possible epidemic is controversial, particularly because of the politics of it. Every parent will fear their child is going to become sick if bitten by a tick, and we can't have that. It will flood the medical industry with new patients and bankrupt the insurance carriers. Ticks are everywhere, and most everyone has found one on them at some point in time in their life. At the completion of my visit, I left the office with a very complex treatment protocol, 6 different antibiotics, dietary changes, supplements, and orders for routine lab work to ensure my kidneys and liver could handle all the antibiotics. Further blood testing, hormone, and low metabolism testing were all part of my protocol as well. Approximately 3 weeks later, I received a phone call regarding my blood work. My doctor had ordered a very specific lab test, and this careful examination of my reactive antigens proved it. 4 markers indicating proof positive for a tick-borne infection similar to the Lyme bacteria. 6 years this took. How could this have happened? How did I slip through the cracks of all these doctors? So here we are today, a little over a year into treatment. I'm happy to report that I'm about 90% better, and my prognosis is bacteria-free within the next 6 months. So if you find yourself in a similar position, where do you go? First, find a Lyme literate doctor, and don't be fooled by your own family doctor, your insurance company, or what you read on the internet, that these types of doctors are not legitimate, because they are, and I'm proof of it. Does your story sound like mine? Don't lose hope, because help is available. At the end of this presentation, I have provided you with some excellent resources. Please use them. When you find a doctor you're comfortable with, please make sure you treat with one who is understanding, open, and knowledgeable about tick-borne infections, particularly one who considers himself a Lyme literate doctor. If you have to travel to see him or her, do it. I promise you it will be worth it. Before we close, I want to give you some basic tips on preventing tick bites and then some what-to-do tips if you do find yourself bitten by a tick. This disease does not discriminate, and it affects all races, all genders, and all ages of people across the world. Furthermore, and probably the most concerning, is we have no idea how many dangerous bacterial strands that ticks are carrying that are yet to be discovered. It could be in the hundreds. Where there is vegetation, there are ticks. No person over the other is immune from exposure, and response to treatment will vary amongst every individual regardless of your background. Please educate yourself and don't expect your regular doctor to have all the answers. If you are not a sufferer, please take the time to review the following important information to protect yourself. If you do suffer and need more information, I have provided my email contact as well as some helpful links to some good websites. Good luck and best wishes.